Title: An analysis of NSAIDs and colchicine in the treatment of acute gouty attack. We would like to express our gratitude to our sponsor, First Cup Coffee, the original seed, for making this video possible. Shop firstcupcoffeeusa.com. First Cup Coffee, the original seed, is dedicated to providing high-quality coffee that fuels your studies and work with a rich and invigorating taste. We appreciate their support in bringing you valuable, free educational content. Remember to visit firstcupcoffeeusa.com for your daily dose of exceptional coffee. They also provide catering services for events and have a selection of fashionable clothing items for sale. Message them on Instagram at CoffeeFirstCup to receive generous discount codes. Introduction. Gout, a form of inflammatory arthritis, affects millions worldwide and manifests as sudden and severe joint pain, commonly in the big toe. Acute gouty attacks necessitate prompt intervention to alleviate symptoms and prevent complications. Two primary pharmacological options for treating acute gouty attacks are nonsteroidal anti-inflammatory drugs, NSAIDs, and colchicine. This essay delves into their indications, mechanisms of action, MOA, adverse effects, and miscellaneous considerations in managing acute gouty attacks. NSAIDs. Indications. NSAIDs like Indomethacin and Naproxen find use in managing acute gouty attacks due to their potent anti-inflammatory and analgesic properties. Additionally, they serve in prophylaxis to complement other gout medications, aiding in long-term management. Mechanism of action. The primary mode of action of NSAIDs involves the inhibition of cyclooxygenase 2, COX-2, enzyme, thereby mitigating prostaglandin synthesis, resulting in reduced inflammation and pain relief. Adverse effects. Despite their efficacy, NSAIDs pose several adverse effects, notably gastrointestinal toxicity, renal impairment, and cardiovascular risks. GI complications such as ulcers and bleeding are prevalent, while renal toxicity may manifest as fluid retention and reduced kidney function, particularly in susceptible individuals. Colchicine. Indications. Colchicine stands as another cornerstone in the treatment of acute gouty attacks, serving both as a therapeutic option and prophylaxis alongside other gout medications to prevent recurrent attacks. Mechanism of action. Colchicine operates through the inhibition of tubulin polymerization, disrupting microtubule formation crucial for various cellular processes. It also impedes leukocyte migration and phagocytosis, thereby mitigating the inflammatory response characteristic of gout attacks. Adverse effects. Despite its efficacy, colchicine harbors a narrow therapeutic window, necessitating careful dosing to avert toxicity. Gastrointestinal adverse effects such as nausea, vomiting, and diarrhea are common, affecting approximately 80% of patients. Miscellaneous considerations. It's crucial to administer colchicine promptly within 24 to 48 hours of symptom onset to maximize efficacy. However, it's noteworthy that while colchicine possesses anti-inflammatory properties, it lacks significant analgesic effects, necessitating adjunctive analgesic therapy for pain management. Let's recap what we covered to solidify our learning. NSAIDs such as Indomethacin and Naproxen serve as pivotal agents in mitigating the pain and disability associated with acute gout attacks. They are also employed preventively alongside chronic gout medications to stave off flare-ups, a strategy avoiding aspirin and salicylates due to their potential to hinder uric acid excretion at low doses, thereby potentially precipitating gouty attacks. Colchicine, a traditional treatment derived from plant alkaloids, operates by impeding tubulin polymerization, thus preventing the formation of microtubules. Its anti-inflammatory properties stem from its ability to suppress leukocyte migration and phagocytosis. Although lacking in analgesic attributes, colchicine demonstrates efficacy if administered within the initial 24 to 48 hours of an attack. It is also utilized as a prophylactic measure alongside chronic gout medications to deter flare-ups. However, its therapeutic range is narrow, necessitating cautious dosing due to pronounced side effects, particularly at higher doses, with roughly 80% of patients experiencing adverse effects such as nausea, diarrhea, or vomiting. Corticosteroids like prednisolone offer an alternative avenue for inflammation suppression, administered orally or via intraarticular injections. They are especially valuable in patients who cannot tolerate NSAIDs or colchicine, providing a viable option in such cases. Conclusion. In conclusion, both NSAIDs and colchicine play pivotal roles in the management of acute gouty attacks, offering potent anti-inflammatory effects. However, their divergent mechanisms of action and adverse effect profiles necessitate individualized treatment approaches based on patient characteristics and comorbidities. Awareness of these nuances is paramount in optimizing therapeutic outcomes while mitigating risks associated with pharmacological interventions in gout management. Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you hear or see in this video.